Assalamu alaikum. The communication day. First scenario, Mrs. Sarah Smith, 69 years old woman with diagnosis of metastatic breast cancer. Recent imaging has shown that the metastasis spread to the mediastinum, causing compression of the mediastinal structure. She is being considered for airway stenting and/or palliative radiotherapy to relieve the obstruction, please, and to improve her symptoms. Please talk to her.
Hello, I am Dr. Muhammad. I am one of the doctors here today. Can I confirm Mrs. Smith, 69-year-old?
Yes.
Hello, Mrs. Smith.
Hello.
Okay, we are here now to discuss some issue related to condition. I will discuss with you, and all our talk will be confidential. Is it okay for you?
Yes, please.
Firstly, do you want anyone to attend our meeting today to be more comfortable?
Sorry?
You want anyone to attend our meeting today to be more comfortable?
No, I think I'm right.
How are you now, Mrs. Smith?
I'm not feeling great, actually. I've been told that I might have worsening of my cancer. I was under the impression that they took out the cancer a few years ago, but apparently I've been having breathing issues recently, and I've had some scans, and I've been told that today they're going to update me what is the outcome of the scan. But I'm very concerned, actually.
I appreciate your knowledge, Ms. Smith, and sorry for what's happened to you. I need to ask, what's your expectation for the result and our meeting today?
I was hoping that you will update me about the findings, actually, of the scan, and hopefully if you can, to reassure me, because I've been really struggling mentally for the last few days.
I'm sorry for you, Ms. Smith, and we have our social and mood doctor here. He can support and can help us. But today I have this imaging result, and it is not as we hope. Sorry for tell you that overgrowth cancer that spread to another place. That's cause for you this your breathing problem. Are you with me, Ms. Smith?
I'm just shocked. Just give me my time.
Your time. I can bring for you some water.
So this is gonna kill me, or like, are you gonna treat this, or am I gonna die from it?
I'm so sorry for you, Ms. Smith, and your words is valid. But unfortunately, the team has revised this imaging and your condition and decided to start what's called palliative treatment. It is not a treating, but we hope to relieve your symptoms. And they
Sorry,
become
what does that mean?
Okay, Mrs. Smith. We have now, I will draw for you. This is overgrowth, and this is your lung. And in between your lung, there is air pipe. And this overgrowth went to this place and become compressing on your airway. That's why you are feeling breathing problem. You are with me, Ms. Smith?
Yes.
The team here, the surgical team, and growth team, they seen that better to put something called the stent that in the air pipe to make your breathing more better. This narrowing from the compression of the overgrowth, we will try to put this stent. I am drawing it for you. This is what's called the sting. It is will help to release this compression and make you more comfortable breathing. Are you with me, Ms. Smith?
Yes. So do you mean that I'm going to have another surgery to put a stent, or is it like a procedure?
I appreciate your knowledge, Ms. Smith. It is a procedure, or we call it like a minor surgery or a procedure. We will start by admitting you and check your blood count to see that your body is ready to avoid any bleeding as possible. And then the surgical team and the NUM team will clean the area and give you some medication to be comfortable and less painful, and start to put this stent. You are with me, Ms. Smith?
Yeah.
After that, that will be in the procedure room or sometime in the OR room, according to the team. Then we will observe you closely after that to observe any side effect can happen. Some bleeding can happen, some injury can happen to the nearby structure. But our expertise hand doctors have done it many times, and it will be low possibility.
And
For
how
you,
long would I live afterwards?
I appreciate your concern, Ms. Smith, but is different from person to person. Once we started what's called palliative treatment, I'm so sorry to tell you, it's a matter of maybe months. I can't, no guarantee, and but I, 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 I am confirming that it is not a threat. It is only to make you comfortable, less painful, more breathing, comfortable breathing for you.
Okay.
So sorry again, Smith, for that news today. But we are here to support you, and our mood doctor, as mentioned, we can make, and I will give you some brochure to read more about this procedure. And anytime you more question, you are here. But now I need to ask you how it is how do you feel about this procedure? Are you agree to go on?
I'm sorry? It's breaking up.
I am asking you, how do you feel about this that we mentioned? Are you agree for it?
Of course, I'm devastated of hearing such bad news, to be honest, but I've been suffering with my breathing, and if this is the only symptom that would help me, I will go for it. I need to speak to my daughter and son as well. It does sounds serious, and I just need to get them on board as well.
Okay, Miss, you need time to see your relative and discuss with them, and we can arrange another meeting. Even we can share a consultant. He may
2 minutes left.
more position than me. And until this time, you have this brochure to read them out. And if you feel your breathing is not good, anytime you can call us and can come back to start it. Okay.
Okay.
For now, you need. I need to ask you any support you need at home for this.
I live on my own, yeah, but I have a carer who comes like twice a day.
I feel like I can feel how much you are suffering, especially with your breathing nowadays. So we can share our social team, very active and very helpful in such. They can help you borrow some another visitors to home uh, and help you on such. It's okay for you?
Yeah.
Okay. Any other support you need, Ms. Smith?
No, thank you.
Any other concern?
Would you be happy to speak to my daughter and son about this?
Anytime, Mrs. Smith, we are here after your permission and your agreement talking any person you need. We are here. We can arrange a meeting as soon as possible to discuss what's the okay?
Thank you very much.
You need anyone to pick up you to home?
No, thank you. Hello.
Yeah, almost time is up. 10 seconds remains. But again, Dr. Muhammad, as every time, your sound is breaking all the scenario, and it will be very difficult to hear in the record. Check your connection, or if you are using earbud or any Bluetooth tool, please talk directly to the phone. Okay, you can yeah,
We'll
reconnect.
get out and reconnect again, okay?
Okay, okay, Dr. Ines, you can comment now first.
So first of all, I think the case was handled well. You ensured that the patient has a companion or a support if needed. In this case, she did not ask for anyone to be there for her. Uh, like you showed empathy, you are caring, which was really good. And you explained that it is a procedure, we do this, and you safety netted the patient, and you offered to speak to her daughter and son. You offered her a leaflet. Uh, I would have expected that you expand more about the palliative options, just to focus on we might consider radiotherapy mainly to work on the size of the tumor and to help with the symptoms. And I would expand a bit about the involvement of the palliative care team and how they manage the symptoms rather than the cure of the disease. But overall, I think it was very well handled. Thank you.
Okay, thank you, Dr. Ines. I will comment, adding to your comment about some points I have to mention. The palliative, here he didn't mention at all the word palliative, and it's clear the cancer is spread everywhere or even to the mediastina. He didn't mention that. I hope you are listening to us, Dr. Muhammad.
Yes,
Did
yes,
you
Dr.
join?
Bassem, I
Okay.
mentioned it from the first dialogue there. At
I
the
didn't
end
hear.
also I
No,
mentioned.
no, I didn't hear that it's spread or
No, no, no. I mentioned after mentioning the spread and explaining and the drawing, I mentioned that she told me that's mean. I think she asked for it will be treatment. Then I told, sorry for telling you that we will start what's called palliative treatment. It is mean like this. Our team decided to do some procedure to make you comfortable in breathing. I mentioned it 2 or 3
Yeah,
times.
yeah. I remember that you did mention that. But when we speak about palliative medicine, it's not about the stent. It's not about. Uh,
the
it's it.
radiation.
It's more about we work on the symptoms. We work on. We might consider radiotherapy, but this radiotherapy is not curative. It's mainly to shrinkage, to cause a shrinkage of the tumor size, etc., etc. I think you mentioned it, but you needed to expand a little more about it. If you see what I mean.
Yes, you
Yeah.
are right. I didn't see the radiotherapy in the. You
Yes.
sent again another part of the. Yes, yes, yes. Okay.
Okay. The other thing here also overgrowth. You kept saying overgrowth, and it's cancer. She told you I have a cancer. Using overgrowth usually whenever you are not confirming is it a cancer or something benign or good. Since this is a cancer, you can use cancer since the start. So you can tell her, yes, there is a cancer and the cancer already spreading to certain areas and it's related to the main cancer. No need to mention overgrowth at all in this scenario. Okay, so whenever you have overgrowth, which is a mass, you don't know is it cancer or something else or shadow, you are still not confirming this is a cancer, you can say this is overgrowth. However, whatever the cancer is confirmed and the patient is saying to you, yes, I have a cancer, say it as a cancer. Okay, this is the second comment. The comment also regarding other concerns. Well, I wrote them in the chat box. Will this cancer kill me? Unfortunately, you didn't answer it clearly. You told her, I'm so sorry, we will try our best to do something to relieve your symptoms. But whenever the question is a clear and direct question, you have to answer it directly as well. So I will ask you again, Dr. Muhammad, what is the answer of this concern? Will this cancer kill me, doctor? How you can
I
address it?
what is Mrs. Smith? But I am so sorry to tell you that this cancer can kill you. And but we are here to support you and to do our best to make you more comfortable and your breathing to be better. And the the next time, the following time, to be more comfortable. No curable, no treatment for this
Okay.
cancer. So,
So yes, it's directly to answer it, but not as it will kill you. They don't accept the word it kill or something will kill you. The most accurate answer or the most appropriate word here, the cancer usually, I'm so sorry to say that, sadly, cancer usually shorten the life of the person who has it. Okay, so you mention it, but by good way. Okay, so the cancer usually shorten the life for the person who has this cancer. I'm so sorry to say that and be more sympathetic with it. Okay. Uh, this the next concern was for how long will I live? Yes, you answered it well. So it different from person to person. Some person might live longer, maybe months, maybe years, maybe less. We don't know exactly for how long. We don't have guarantee for that, as you mentioned. The last concern, can you speak to my daughter? Yes, you can. You can call them, invite them in another meeting. And after your permission, we can sit with them and explain everything regarding your cancer, your diagnosis, your plan. And the last thing, the social here, you support here. Good. You ask, you can ask also with whom you're living. Whenever 2 minutes left, start these questions. With whom you're living? Do you need any kind of support? Are they supported with you? Okay. If you can have a chance to ask about the smoking and alcohol, or if not, you can ask about any wishes in your life. Did you express any wishes, which is advanced directive? How you be treated? Okay. In this scenario, I prefer to start with the advanced directive. Do you think you express anything, or this is the time to express how you want to be managed in the coming days? You can think about it and you can even document it, or you can tell your family how you would like to be managed in the coming days. Why? Because you don't know what will happen. Maybe this patient next time will have worsening of the symptoms. Maybe she will come with the respiratory arrest because of the compression of this mediastinal by the metastasis. And the patient supposed to be DNR because she will not get any benefit from the CPR because she is having advanced cancer, right? So we will not talk about the smoking or alcohol, not in this scenario, because this patient might have
right.
further complication, which
Talk
can
about
be.
still the person. In this, no smoking with alcohol in this sector.
Yes, I said some scenarios, not in this one, but in this scenario, I'm talking in general. Whenever you hear 2 minutes, you can talk about these things, but in this scenario, not to talk about this thing. I'm talking in general. Then I specified more in this scenario to talk about advanced directive. Even you can give a hint about maybe this cancer can compromise or can cause you difficult of breathe, and it might lead to heart stop or stop of the heart. And you can give hint about DNR. This is what I mean, because this patient might come next time with the compression symptoms. Even if after you put the stent, you don't know what will happen. Maybe the cancer will be progressively increase in the size and it will compress. That's why I talk about advanced directive. And if you have time, you can talk about difficulty of having you back whenever you have the heart stop. But briefly, because you don't have a lot of time. The procedure wise, you talk about it, yes. There is steps before and during and after. The consent form, it's a stent, a tube. We can put it to relieve the obstruction or the block in the area of compression. I think here trachea, but it didn't mention in the scenario. So the stent will give you a relief of your symptoms. Give us the approval whenever you are ready. Please sign the form. And there is also option called palliative radiotherapy. It's a type of radiation that can regress the size of the cancer, as Dr. Ines mentioned. Later on, we might have the other palliative therapy in the form of pain-free or depression-free. The mood doctor can help us or can help you. Infection also to be free, and the other support if you need, we can give accordingly. Okay. It's a difficult scenario. Palliative plus stenting as a procedure, and at the end, you can ask about advanced directive plus or minus the DNR. I'm not sure Dr. Ines, she can tell because she didn't mention it. But for me, I would like to add it to your scheme if you have time, because it's very lengthy scenario. You cannot do all of them, but advanced directive is very important in this scenario. You should ask or you should raise it. What's your opinion, Dr. Ines, about the last part I mentioned?
I think if you had time, you can start speaking about it, but it's going to be tricky to mention all of this in one
Yeah,
conversation.
yeah, it's difficult to mention. Yes, you're right.
But at least to show that you're holistic and you look into the whole image, you
Yeah,
can just say that this is part of the conversation. I think we need to arrange another appointment in the next few days
yeah, it
just
will
to,
be difficult.
yeah.
Yes, sure. Can be in another meeting. And the good thing here also, Dr. Muhammad used breaking bad news. It's very bad news. The patient was shocked or the surrogate was shocked. You have to offer her something like water or tissue if she's crying. And that's it for the support, sympathy, empathy, palliative. I think we covered all points related to this scenario. It's lengthy one. I don't think we can bring such scenario with a lot of task. The palliative plus stent plus at the end, as I said, the points of support, advanced directive. However, if you have the time to do all these things, you can consider them as essential thing. Okay. Any question, Dr. Ines, or added point?
No, thank you very much. No, that all good.
Okay, Dr. Muhammad, anything comment you want to add or question?
So the same as you mentioned regarding the wishes. I remember I practiced one case before, and they
Mm-hmm.
mentioned only one sentence you tell at the end,
Mm-hmm.
even you have time. If you don't have time, one sentence. Please, if you next meeting, you can think about any wishes, any
Yes,
expectation, any like this, and document it if you need. بس one sentence بس as a hint only, not too much يعني about this.
yes. Okay, so agree about the future plan regarding the advanced directive. It's not a current one, and it's a future one. Please think about your future plan regarding the medical management. Express your wishes to your family, whatever related to the medical management. She will understand that she also might think about any living wish she can express to the family. I think this is the scenario in all points related. The smoking and alcohol, no time, and even it's not something to be done. Don't, or I discourage it. Don't talk about smoking and alcohol in patient who has last month or last few weeks. They can minus you. It's a negative point. Okay. In another scenario, you can talk about, for example, if the patient having infection related to the lung, you can talk about it. But once the patient is having spreading or advanced cancer or advanced situation, terminal lung disease, and she is or he is about to be dying, no need to prohibit or to ask stopping the smoking or alcohol. They don't like it. They can minus you. Okay. Any comment else, Dr. Muhammad, you want to add before moving to the next scenario?
No, no, thank you.
Okay. Yes, Doctor. Okay, like someone asked the scenario. Dr. Inas also. Yeah, actually, a scenario my colleague has had today. You mean in exam, Dr. Inas?
Yeah, yeah. In the survey exam.
Okay, so they are focusing on this palliative.
And my other colleague yesterday, he has had a kind of similar scenario, but it was a lady with a breast cancer, and her appointments to follow up has been delayed because of the backlog. And when she managed to see the doctor, they found that the cancer has metastasized elsewhere. And if she did not, if she did manage to see a doctor a few months ago, maybe we could have picked up quite early on. And I think one of the concerns was she did mention that her sister has breast cancer, and they expected the candidate to mention about the BRCA testing and the genetic testing for breast cancer. This is one thing, and the other thing is to apologize about missing the appointment and
Yeah,
investigate why that happened and how to prevent that in the future, etc., etc.
yeah. So you are, in summary, you are trying to say that they are bringing multitask.
Yes.
So one of them, it could be a medical error or misappointed or misappointment or missed appointment for another patient, for the patient. And in the same time, you can speak about the palliative, and they might have also another concern related to the genetic counseling related to the breast cancer. Yeah, I think they are doing such issue nowadays, but again, concise way. Don't speak a lot to cover all the concerns. And always be a listener. Listen to the surrogate. Let her talk and express what she need to say, and address everything accordingly. Okay. Yeah. Someone want to comment, Doctor? Okay, I will give you the chance to comment. It's not only my comment. I will give you the chance. I will read the scenario only for Doctor Inas. Then others can comment. Doctor Inas, your scenario. You are the doctor in the ward, Mr. Farouk. He is 53 years old. The patient was admitted to the emergency department today on account of skin bruises and nasal bleeding. She is being followed by the dermatologist, and has been on methotrexate for her psoriasis and psoriatic arthritis, which has been well controlled. He has urinary tract infection symptoms 1 week ago. She saw the GP on account of lower urinary, and the GP started her on trimethoprim. Blood test done at the presentation at the emergency department showed platelet 23,000, white blood cells 100, and the hemoglobin is 8. The methotrexate has been stopped, and she has been commenced on folinic acid. She's quite worried, upset, and worried about her current symptoms and willing to discuss with you. So the task is to discuss the error regarding the trimethoprim administration with the methotrexate, which led to her symptoms. The treatment plan address other concerns she might have.
Sorry,
She,
can I clarify?
yeah,
Because I'm not familiar with these numbers.
yeah,
A platelet of
All low,
23,000
doctor.
is low, right? Everything
All
is low.
low.
yeah,
All of
yeah.
them low.
It's
All of them low.
pancytopenia.
Pancytopenia, yeah. Cool.
Okay. I think also white blood cells is 10 or less than 10. 100 means 100,
100,
right?
100.
Okay, not 100. Okay, it's
He
100.
has
So it's,
pancytopenia.
yeah,
Pancytopenia is huge.
pancytopenia.
Okay.
Okay, and she is not she is. So we can assume Julia Smith, 53 years. Okay. Now we'll go to Dr. Ihtisham. Yes, you can comment, doctor.
Assalamu alaikum. Uh,
Alaikum.
yeah, I just have a quick comment about the last communications. So,
Yes,
obviously, because it was about a breaking bad news, and the patient
yes.
definitely had some kind of an emotional upset because it's quite upsetting to get that news as well. So, I think that don't you think that it would be better that at the end, if we can just ask patient about the understanding, because you have broken one news, and then you have given a plan that okay, I'm going to this do this stenting in future, or whatever the plan was, or palliation, just to make sure that the patient understand whatever you have discussed. And if not, then you can at the end you can recap whatever you have discussed just to before conclusion. So that's the one thing I feel, that if that's something which we can add as well.
Yeah, thank you, Dr. Hisham, for your question. Actually, the mental capacity you want to say, right? Whenever you have patient can understand and you are keeping following every point after every point explaining or drawing or saying it, and the patient can understand it, it's fair enough to finish this part in every sentence. What I mean, the mental capacity, you can check it after every sentence. If you have the time at the end to recap, you can do the recap. But as I said, you can see how many points you have to cover in such scenario. The palliative as a stent. First of all, the breaking bad news. Second thing, it was the procedure plus the support in between and the crying, the emotional reaction, and the radiotherapy, the explanation of the procedure, the consent form, and the support at the end, and advance directive. I don't think you have the time to recap. Sometimes you might finish the scenario and the task early. If you have the time to do the recap, you can do it. Otherwise, I don't think you will have the time. You must do the capacity check in certain scenarios. Okay, if they ask you in the beginning or in the scenario that the patient is having problem and you want to check his capacity, sometimes they bring such scenarios. So at the end, you have to ask him about the recap. The second scenario, any suicidal attempt. If you have patient with suicide attempt and you think he has defect in his mental capacity, at the end you can ask him or her about the recap. Okay, or you have patient with dementia on and off. You think the patient is confused, he's not well understanding. Again, you can ask him at the end to recap. These are the scenarios you can recap or ask patient to summarize what have discussed between you and him. Otherwise, believe me, in the exam, the patient or the surrogate will rush you with a lot of concerns, and at the end, you will not have the time even to ask about something you wanted to ask earlier, like driving, like smoking, like alcohol, like support. That's why, whenever you are done with your task, you have a time, you can do. Otherwise, be good listener, finish your task, finish the concerns, and that's it. I hope it's clear, Dr. Ihtisham.
Yeah, thank you very much. That's clear. Thank you.
Okay, thank you too. And omnium communication, Dr. We
Uh,
just, yes. Yeah, we can do if you have time again. The last comment, Dr. Rasha, before moving to the next scenario. Usually, I cannot attend live session. I attend the record in the long clinical consultation. Sometimes there is a photo for rash or other sign. Where it is posted, please. Yes, the sometimes they are posting it to me privately, or you can see it in the WhatsApp group, or it will be in the video title outside. So that the video title outside, it could be that the picture of the rash or whatever. Anyone has request to see these things, you can message me directly. Okay, Dr. Rasha? Okay. Dr. Nas, you ready? Any
yeah,
question before moving? to the next scenario. Anyone want to add comment or question? Okay, here you go, Dr. Yunus.
Sorry, what's the patient's name and how old are they?
Julia Smith, 53.
53, cool. Okay. Oh, hello, my name's Ines. I'm one of the doctors here today. Can I just confirm that I'm speaking to Julia?
Yes, I am.
Oh, how are you doing, Julia, today?
I am not good, doctor.
May I ask why?
I was okay for years, and since 2 days I have bleeding from my nose, my mouth. I am not feeling good. I don't know what's happening for me.
I'm really sorry. I'm really sorry. I may actually have an answer why you've developed all of that, but would you mind if I ask you a few questions? Then I will let you know what's going on and how we're going to manage it.
Yes, doctor, I am hearing.
So I understand that you do use methotrexate for your psoriasis. Am I right?
Right?
And how is your psoriasis and psoriatic arthropathy doing these days? Are they well controlled?
Yes, very nice, doctor. This medication is very good for me.
Okay, okay. And how often do you take the methotrexate?
What?
How often do you take it?
How often?
Yes.
As prescribed for me from my joint doctor. He
Okay.
gave
And do
me
you,
weekly one dose. I am taking, and
okay.
since it's okay,
And do you take the folic acid as well?
folic acid.
Yeah.
Maybe this is a new medication they prescribed for me. Maybe I don't. I am not sure.
Okay. Okay. So usually when we give the methotrexate, we normally give folic acid. That's normally taken on the days when you do not take the methotrexate. But I can double check that by looking to your records from the GP. But I understand that you've recently developed a urinary tract infection. How are you doing in that regard?
Better.
Better. That's good. And are you still taking the antibiotic that's been given by the doctor?
Yes, doctor. I didn't finish the course.
Okay. Okay. Um, so I really appreciate everything that you're going through, but I can only apologize that during the hospital admission, you've been given an antibiotic that it's not really advisable to be used with the methotrexate because if we used both of them together, we would expect to see the symptoms that you've had, including the bleeding in the skin and the bleeding from your nose.
Doctor, you mean that this GP harmed me by giving me this wrong medication?
I am really sorry. I can only apologize about that. And I cannot really comment on other doctors' prescriptions. However, trimethoprim is one of the antibiotics that we do not usually prescribe if patients are in methotrexate. And very unfortunate that you're being given this and that appeared in your blood records where your platelet and the white blood cells, which is the fighting blood cells, and your red cells, which is the hemoglobin, are all low. And unfortunately, this happens if you take such antibiotics with the
What for me,
methotrexate.
please? I can't understand all this, doctora. What's happened for me? This bleeding because of this medication, because of this doctor, right?
I appreciate that it is a lot of information. I'll try to break it down to make it easier. And like, and again, I can only apologize for the mistake. And we're doing everything that we can do to understand exactly why that happened. So we run our investigations and understand where that happened exactly and how we can prevent it in the future. But in your case, methotrexate is one of the drugs that's fantastic for psoriasis. However, we need to be careful when we give some antibiotics because some of these antibiotics, including the trimethoprim, will cause toxicity from the methotrexate, which makes the methotrexate action 10 times what we wanted it to happen. And this what explains developing the bleeding and the other symptoms that you suffered from.
Okay, doctora, what you will do for me now?
So first of all, the first thing that we need to do is to stop the antibiotic, the trimethoprim, and we need to withhold the methotrexate for now, and we need to give you a drug called folinic acid to overcome this stage, and we need to keep you in the hospital if you don't mind that, and we'll keep an eye on your blood results and make sure that all of your cell counts are recovering. I'm really sorry this is not the thing that you wanted to hear from me today, but it is my duty to be transparent with you and let you know exactly what happened and how are we doing to improve this for you and for other patients in the future. Am I making sense?
Yes, doctora, but this methotrexate will stop for me. It is a, as you mentioned, a fantastic drug, and I am okay. This mean my skin rash will come back and my joint will be more pain back. I can't go to my work. It will be a problem for me, doctora.
I really understand where you're coming from, and withholding the methotrexate will be temporarily, and we will do it only after we discuss it with your parent team, including the dermatology and the rheumatology team. We make sure that they are in agreement, but for the time being, I am quite worried about the cell counts, and if we continue the hello. At, at,
Yes,
at this time, I'm quite worried about the cell count. And if we continue using the methotrexate, I'm afraid the situation would be only worse. So it's very important to withhold it till your cell count's recovering. And after your cell counts recovers, and we give you the antidote for that toxicity, we're hoping to restart it slow and low. But this would only be under the guidance of your parent team. Do you understand what I'm saying?
Yes, doctora, but I need to go home. You are telling me you will admit me. I feel this bleeding. We can compress on it, and I can go home. I have many business.
Well, I'm really sorry that we're causing this distress to you, and I appreciate that no one at the end of the day would like to stay in the hospital. However, I am quite concerned about your cell counts, including the platelets, the white cells, and the red cells as well, and they are all low, and I'm quite worried that we need to get them better before you go home. Is there any way that you can ask one of your family or friends to help with your business for the time being?
I will see, doctor. I will try for this.
I would appreciate that. I'm really sorry. This is not the news that you wanted me to tell you today, but we need to do the safest thing for you and we need to look after you. And if you did not feel satisfied and you'd like to make a complaint about what happened, I can guide you through the procedure because we do have the patient advance and liaison service, and they are the best people to make a complaint to, and they will be able to update you about the outcome. But like I said, we have a specialist team on the ward as well who will investigate exactly what happened, and they will be in touch with your GP and to understand exactly where the error has been made so that we can prevent it in the future.
Okay,
Would that,
doctor. I will complain against him. Okay.
I can talk you through the procedure
2 minutes left.
of making a complaint. However, at this point, I'd like just to I'd like to ask you if you started to develop any worsening of your bleed or any bleeding from any orifice, or you've seen blood coming out from your stool or sputum or anything like that, please make sure that you let us know. And if you started to have like large bruises, you became dizzy, please let us know because we might need to give you some blood products to help your cell counts pick up until the folinic acid starts to work. Am I making sense?
Yes, doctor. It's clear. But regarding this complaint, it will not affect my treatment.
No, no, no. Of course, this all is confidential, and you will apply directly to you through the bells, which is the patient advice and liaison service, and it's only to make a practice better. And you will not be you will not be judged if you make a complaint. It's only one of the ways we reflect on our practice.
Okay, doctor. Thank you.
can I just make sure that I was clear? Are you able just to say in your own, I might sound silly, but if you're able to let me know in your own words, what did you understand from our conversation today?
Yes, doctor, I understood that this new antibiotic that I have taken affect my blood cells that cause my bleeding and my suffering. That's why you need to admit me for avoid any other bleeding, following my cell count improve, and that's okay.
Yes, absolutely right. I just wanted to add a very, very small thing. If you decided that you want to go home without having a treatment, I would be very worried that your cell counts might go low and low, and that might be really critical. So I do not want you to be in that position.
Okay, doctor, خلاص, I agreed to see that. إن شاء الله.
Okay, cool. Thank you.
Okay. Yes. Time
Why?
is up. Almost time is up. Thank you,
Doctor,
Dr.
sorry,
Anas.
I sometimes silly. Sorry.
Oh,
But this is what's happening in the exam result.
sorry.
Okay, you can
Okay.
comment now, Dr. Muhammad, then I will comment.
Yes, Dr. Basim. Dr. Sally did it well regarding the communication. But again, I don't know. I am the one noticing, or you, Dr. Basim, you can comment. يعني the statement too long. And I feel like this. يعني I think better to be more short and appreciate that the candidate with you, the surrogate with you. Start this طبعا a medical error. I didn't know that the starting to check the problem for the patient. I think better also to be more short and go to the task directly after checking that he know that started this antibiotic recently, and this is mostly who's more toxic or affecting his blood count. This is the cause of his bleeding. Then apologize for this. He will be angry, and the trick here, he didn't ask for complaint, and you offer him complaint. He was only unsatisfied and angry, but usually let him tell you that I will complain. At this time, you will guide him and telling that you will look into this what's happening, will be incident reporting as you mentioned, and he is the problem in GB, not in the hospital. Some monitors said that better to see the GB manager because pulse in the hospital, but the same يعني problem, but GB away from the hospital. Then we'll go to the when he stopped you for about to mention that this is because of the doctor. You started to mention about the why you need to admit him and about his blood counts. You concentrate only on the his bleeding because of platelet that he has his cell responsible for control bleeding, stop bleeding is very low, and he may need blood transfusion. And this is a good point to tell him. But the other issue, you will admit him, and not only admit him, he will be in a single room because he's also white disease. He's neutropenic. And he's very risky to go home and go anywhere. He can catch infection, and this is also another red flag. You will admit him and not and in a single room to be and attention about this because your fighting cell is very low, you are high risk for getting infection. Because if he get infection from the room, he will complain again. And what about the medication? You will stop طبعا both methotrexate and the antibiotic. But after you telling him stopping, you can directly tell him, but after that, you will be reviewed by the gene doctor and immune doctor. They will follow you and select the best time to restart. Same your methotrexate or will change it according their your lab and cell count, and you will follow your count closely until it becomes to safe level. So from the red flag bleeding, and if he go home, if he insists to go home, at the beginning, and we will tell him about you have high risk to bleed in another serious areas. Maybe bleed in brain, maybe bleed anywhere. It will be serious and threatening for your life. And you may catch infection. Also, it will be serious for your life. You mentioned the support of his once he accepts to be at the hospital. You ask any support at home who will use you. Then the brochure and leaflet about his condition. About that's all.
Yeah, thank you, Dr. Muhammad. I think I will just say it like you did the scenario perfect as a jargon way. Sorry to be tough in this comment, but you are explaining everything like you are talking to a medical field person. You are giving the example of infection, urinary tract infection, and antibiotics, and the antidote, plus taking history initially, which is against the communication scenario. If you read the instruction, any communication scenario, they will ask you, don't take history. So go direct to the task. You ask about what you are taking as a medication, how long, and what about the folic acid you are taking them, how frequency you are. All these consider as taking history, which is against the communication skill. So what I have to do, I will ask him, as we know, the introduction, confirming. If you want to ask, how are you now? How do you do? What do you know about your condition so far? He will tell you, I have taken this medication regularly and everything was okay till my GP did that or started this medicine. I think there is something happened after that. Okay, I appreciate sharing this with me. What do you expect happened? What do you think? What's ongoing? He will tell you, or she will tell you, I think there is something wrong. From here, this point, you have to address it and to be honest from the start that there is a mistake. This is what we call it duty of candor. Don't hide. You have to say this is clearly as an error. Yes, there is a mistake. And it's, I don't know how this mistake happened because it's outside the hospital. You are talking to the patient in the hospital, and she was prescribed this medication by the GP, which he is outside the hospital. So the best way is to say, usually we are not prescribing such medicine or medication to a person who's taking the medication for psoriasis. And don't say psoriasis. You can tell her, how about your condition? You said you have psoriasis. How is your psoriasis ongoing? How is your psoriatic arthritis? She might have some doubt about what you are talking about. I know there is something in my disease, in my joint, in my skin. She might know the condition as a name, or she might not know it. If you want, you can say, how is your condition ongoing? In brackets, Dr. Inas, in brackets, you can imagine yourself talking to your neighbor or to your friend who is not in the medical field. So you are trying to simplify everything to him, make every sentence simple as much as you can. Okay? After that, after explaining what happened as an error, you can tell him, he will tell you, do you think it's something wrong? Yes, I believe it's not our usual habit that we are prescribing such medicine or antibug along with this medicine, supposed to be another antibug. In your condition, this medication was mistakenly prescribed for you. So do you think, doctor, he did a mistake? I'm so sorry. I don't know what happened there. He might have, or other circumstances happen. I'm not sure about it. You can review you have a chat with your GP, for example, and we can be back together in another meeting to be sure what happened. He might not know about hair condition. He might not know about the methotrexate. it's uncertain. You don't know what the situation he has prescribed this medicine for her. She might not tell him that she is on methotrexate, right? So all this is not clear for you. However, it's an error if it was prescribed as intentionally, and be sure this is not intentionally happened. He is not intentionally prescribed this medicine for you. There is something you don't know, and you should know by chatting your GP. Okay, I'm trying to be more detailed, just to explain how to do it, and you can do it by your approach next time. Okay, doctor. Okay, so what you will do for me now? Unfortunately, this medicine interact with the medication you are taking for your joint, and it can cause the low blood count, low blood, the red one and the white one, and there is what's called platelet. Don't bother about these terms. I will explain to you. The low blood count can lead to some short of breath, and we might need to give you blood. The white blood cell what might lead to infection. You will be more susceptible to have infection. And the platelet, one of the component in the blood, can also lead to more thinning in the blood. That's why you have some bruising in your skin. Am I clear till now, Dr. Inas? Anyone has any comment in between? He can write it down. Then
Oh,
we will
yes.
discuss.
Thank
Okay.
you.
Okay. So, okay, sorry. Then I will ask him, or he will ask me, doctor, what you will do? Yes, in case if you have need any blood, we will give you any of the blood product, either blood or platelet, which can correct your thinning in your blood. Next, this is the first thing you have to correct the anemia and the thrombocytopenia. What else, doctor? We hold the medicine, the methotrexate, and we stop the antibug immediately. And we will find another suitable antibug for your condition. Okay? Doctor, will it improve, or will my condition improve? Hopefully, after stopping the medicine and giving you the antidote of the medicine you are taking, which is called folinic acid, you might have back to your normal blood count. And for that, we will monitor you. We will admit you, as Dr. Muhammad mentioned, to monitor the blood count and everything. Why this happened? You can explain more if he asks how it happened regarding the bone marrow. I mean the bone formation of the blood cell, which is affected by the other medication which added recently. If he asks, if not, don't go in details more than I said. Okay. Next, what else, doctor, you will do? Now you can talk about the report. We will report what happened. If he raised the complaint by himself or herself, you can ask her or you can guide her. But if she don't ask about it, don't talk about it. Don't offer to let her complain. They might say you offer the complaint by yourself, which is something they might minus you on it. Okay. Whenever he asks or she asks, doctor, I want to complain. You can tell her or her, I will guide you how to complain, and you can mention the pulse. And not only you have to mention the office responsible in the hospital, which is the pulse office, patient advice lesson services, or as Dr. Muhammad said, the GP surgery or the GP manager, which is outside the hospital, responsible for the GP. But you can guide him through the pulse office. Is it clear till now, Dr. Inas? I hope it's simple and clear. I'm trying
Yes,
to make
yes.
it
Thank you.
simple as
It's
much
all
as I
good.
can.
Thanks.
Okay. Next, what other concern he will raise after the complaint? Would you affect or would this complaint affect my care? Absolutely no. We are here to support you. Don't worry, your care will not be affected at all. Okay. Then at the end, you can talk about the support. 2 minutes left. You can ask any concern. Then with whom you're living, any kind of support you need. Do you smoke? Here you can ask. Do you drink alcohol? Why? Because also these things can affect the general condition regarding infection or in the future cancers or whatever. If there is something can affect the daily activity, you can talk about it. How that affecting your daily activity or your job? What's your job? And you can be sorry for that. You can even offer sick leave because this patient has an error or she will not be joining her work because of your GP mistake, not your the GP mistake. So you can offer her sick leave just to compensate her days or off days work. That's it. Thank her and again ask her about concern and be sorry again for this mistake. Yes, initially you have to say, I'm so sorry for your suffering, and you can apologize once, although it's not your mistake, but it's a kind of being sorry, deeply apologize for this mistake, which is not our usual habit. Okay, so you are doing good, Dr. Ines. Apart from explaining detailed medicine, which is very difficult to be understood, and they will comment about that you are talking in a medical way or using some jargons, and that the surrogate will argue with you that you are saying something which is very difficult to be understood. Take care of these things. Be simple and approach, as I said, whatever your approach, do it, but in the same way what I mentioned. By the way, it's very common scenario, the methotrexate interaction with the trimethoprim. So the steps will be the same. Being sorry, apologize once. You can offer the medical reaction, what we have done, and then the non-medical reaction, we raise it in the hospital. For example, if there is mistake in the hospital, if outside, you can say we will have a chat with your GP, or he has a chat with his GP. Then we will update you what happened exactly. And the medical action already we talk about it, the blood product or the folinic acid as antidote, and the social support, the smoking at the end, the concern, and thank the patient again. He will ask for complaint, guide him to the pulse or the GP manager. That's it. I tried to summarize it again, but it's a very common scenario. I hope you got it, Dr. Ines.
Oh,
If you have
thank
any
you very much.
question,
I appreciate it. Thank you.
yeah, most welcome. Any question you want to ask?
Dr. Bassem,
Yes.
regarding this case, the mistake happened outside our hospital.
Yes.
I mean, should we apologize for that, or we just deal with it like uncertainty? Or
Yes.
because I will apologize behalf of the GB from outside, not
Yeah,
happening in my in here.
yes, you're right. Yeah, you're right. Since the patient is admitted now to you, even saying sorry for once or apologizing once, it's enough. You can be sorry only, but if you feel he is very angry, try to absorb his anger by apologizing once. Okay, don't show him this is our mistake or our team mistake. However, the GP is outside the hospital, as I mentioned. So it's not on behalf of the GP. We are apologizing for what happened to him, or we are sorry for what happened to you. If you don't want to apologize, it's okay. They will accept if you feel more sympathy with him. But please, if he insists and he's very angry, be apologize only once. Okay. We always say no need to apologize. I am honestly saying that in previous session. Sometimes I'm saying no need to apologize. But if the patient or the surrogate very angry, sometimes the apology will absorb his anger. That's why do it once and don't do it again. Just be sorry for him. I'm so sorry for suffering. If you
I
feel
might
he's
disagree with you, honestly.
yes, why?
But
Like,
I should
because
admit it's a mistake.
Yes, there is mistake.
apology does not mean that you are admitting the mistake of someone else. Like, I've noted a lot of people in this chat, whenever the patient says, like, I'm suffering from headache or something, they would say, I'm sorry to hear that. You're sorry that the patient has headache, but you're not sorry that the patient has been given a wrong antibiotic with a significant medication like methotrexate. And I think the same as the GP, if your colleague in the hospital gave the patient, for example, if the ED doctor give the patient trimethoprim, and the patient has been admitted to the ward, and you are the medical doctor, and you spotted that, would you apologize for that mistake that happened in ED? Yes, you will.
Yes, yes,
It does
yes.
not
I'm
matter
talking.
if the mistake happened from the GP or the ED doctor or your previous colleague. The patient is having pancytopenia because of an error, and because we are as a team, we need to be apologetic for the mistakes that we do. It's not about when you say like you're sorry, you're not admitting I've done the mistake, but we're sorry as a team. We've done this for you,
Yes,
and
I got your point, Dr.
I've been
Ines.
told before, actually, in communication setting, that your apology should be unconditional. So you should not say, I am sorry if this caused harm. No, you just, I can only apologize for this. It's very unfortunate that it did happen. Full stop. You're not going to lose anything, and you don't need to see an angry patient to say that, because it's honestly, if you're the patient, would you be happy if I did not apologize to you?
Yeah, I got your point. So let's talk about, as you said, teamwork. Actually, the GP is outside the hospital. Yes, there is mistake, but I cannot admit this mistake belong to my team. So I consider the GP outside. I don't know what the situation he prescribed this medicine. You don't know what happened there. She might not tell him about the methotrexate. However, he should ask about any medication patient on. I agree for that. That's why I said you can be, or you can say apology once, or even you can skip it by saying I'm so sorry for your suffering or about this mistake. It's unintentionally happened. So it
Uh,
depends on the scenario and the reaction of your surrogate in front of you. You can do either this or that.
yeah, that's my point. I mean, we have no idea about the circumstances that the
That's
GB
why I
prescribed.
said, yeah, that's why I said you can or you cannot. It's depending on the scenario itself.
Okay.
Some, by the way, some examiner they can accept it, and some examiner they can say as a minus, or they can cut your marks because you apologize on someone mistakes which he's not in your team. It depends on the scenario. Actually, there is a lot of debate about this. Even mentors, no mentor is saying
Yeah,
you have
exactly.
to.
Some of them they said just apologize, and some of them said no
Yeah,
because it's happening outside the hospital and you have no idea of what is going there. So you should be empathy and sympathy and just
yeah.
say sorry, no apologize because you have no idea what's going on.
So the best way, diplomatic one, start by saying sorry for this mistake. Then later on, if you find the patient still angry, you cannot talk to him because of his reaction. Say, I'm so sorry and I apologize about this mistake. Whatever the person who did the mistake, I apologize for that. Just to absorb his temper again and just to calm him down. Then skip to the next point. Okay, I respect your point, Dr. Ines, but the paces sometimes will go against you expect. Okay, you expect that they will say yes, you have to apologize. Some examiner will minus you, and other examiner they can accept it. Some examiner, as I said, they can say against the paces exam, they can cut your mark for it. So please do it as neutral. Be neutral. If you feel this the surrogate still angry, apologize. If not, you can continue and go ahead.
I think
Yes,
there is
doctor.
an element of cultural difference here.
Yes, of course.
Mm,
I'm talking
yeah.
about overseas, by the way.
Yeah, I
In
think it's different
overseas, yeah,
overseas.
yeah,
Here in the
overseas.
UK, they apologize about every single thing.
Okay. But in overseas, they are not. Sometimes they are judging in this way. In UK centers, I believe they have different beliefs, and they are accepting, or they can encourage even to apologize. Why? Because they are considering the GP one of the teamwork, right? So they are apologizing on behalf of the GP himself. So again, it depends and judge it according to the scenario.
Yes, Dr. Basim, there is a similar scenario. It's not similar, but somehow like this. Patient with he was a known case of epilepsy, and he
Mhm.
was epilepsy free for maybe last 3 years.
Yes.
And he was admitted to ortho department and get some surgery, I don't know, and he discharged with the tramadol.
Okay.
After maybe 3 days, 4 days, or 1 week, he just admit again to ER with status epilepticus.
Because tramadol is one of the
Yeah, I mean
epileptogenic
this.
medication.
Yeah, exactly. I know. يعني we should apologize or just we keep it like I don't know because it's not absolute contraindication to prescribe tramadol for epileptic
Okay.
patient. And he was epilepsy free for 3 years, and also the what happening there maybe the patient was in severe pain and he didn't respond for only the tramadol. So should we just make it as error or uncertainty?
Yeah, for this, I will say this is an error. Why? Because first of all, it happened in the hospital.
No,
So the
patient
yes,
was discharged already.
yes, but discharged from the hospital. He was
Yes.
in under the orthopedic in the hospital.
Yeah.
So suppose this patient to be prescribed medication in the best interest by multidisciplinary team. If the orthopedic has an doubt or has any doubt about his epileptic condition, he should call the neurologist to get opinion from them. So he didn't do so, and he started tramadol. Maybe he didn't have the history of epilepsy. He should ask about the history, or the patient should written in the scenario or in the report that he has epilepsy, and he should also be reported that he has epilepsy. If all these things documented and still the GP, the orthopedic prescribe for him tramadol, which is having some epileptogenic effects, this is a mistake. Why I'm saying mistake? Sorry, because there is another opioid or another painkiller he can be given or he can receive it instead of tramadol, which is very epileptogenic, right? So
But I mean, it's not absolute contraindication
it's
even the
not
tramadol.
absolute. You are talking about there is percentage, but why I will put myself in a debate that I should give or I shouldn't give. If I have another safe medication, why I shouldn't start him on since before? There is
So,
safe
so
medication. Yes,
from
I
the
will
beginning, I should
apologize.
take it as apologize and error.
Apologize. Yes. Tramadol
Okay.
is known medication or known painkiller or analgesic or opioid that can lead to or it can reduce the threshold of epilepsy. So the patient, if he has any trigger, the patient easily will have epilepsy. So I think,
Actually, at the beginning, I when I read this scenario, I thought
okay,
it's error, and then I heard it from someone. He make me confused. He just deal with its uncertainty. Yeah, you will admit there is harm for the patient, but it's uncertainty. Just we will investigate and see because we have no idea about what's happening there in the art department. Maybe the patient he wasn't respond for any analgesic. That's why he discharged tramadol on all that things.
it,
That's why I
sometimes,
confused now.
no. For me, I will do it as an error. Why? Because if you have severe pain that you are not controlling it and you have difficulty to control it, easily consult the anesthesia team or pain management team. Don't start something you have any doubt about it. You got
Okay.
it?
Yes. Thank you.
Yeah, it's not common scenario, but it was old scenario, but maybe they are y-
Reappear again. No.
yes, they
No, it's
appear again.
not
And
serious.
I noticed that most of the exams, one of the scenarios as an error, and the other palliative and other counseling or complication, okay, counsel about the medication, counsel about the disease, and one of them as an error. Maybe because of the mistakes happen all over the world from the medical field, and they want to minimize these mistakes to give more alert about the errors happening in the hospitals and how to deal with them. But if you can see the recalls of the recent exam, most of the days having medical error with a different scenario, of course. But they want to see if you are dealing well with the medical error and how to deal with it. I hope it's clear for all. Let's open the discussion. Anyone want to comment? Firstly, Dr. Muhammad and Dr. Inas, anyone want to comment?
No,
Okay.
thank you very much. That was very helpful for me. I really appreciate.
Okay. Back to the comment. First, jargon, Dr. Rashad, rheumatologist. Yes, although it was written in the scenario, but you haven't to say it. If you want to say, you can say the skin doctor or the joint doctor. Don't say as dermatologist or rheumatologist. Incident report. Dr. Dina is asking about incident report. Whenever or wherever the mistake happened in the hospital, you can raise the incident report. However, in this scenario, the mistake was outside the hospital, so to whom you are reporting? Okay, so the insert report raised only whenever you have the mistake happen or the error inside the hospital. Otherwise, you can say, I will inform the medical director or I will inform the manager, GP manager to investigate more with your GP. Okay. Recap, Dr. Zahir, recap in error case here, is it advisable at all? Never ever recap in a mistake or an error scenario. Not advisable, exactly. Why? You just irritate him again. Or let's recap what happened with you. You have a mistake, or you have mistakenly prescribed medication which lead to this medication. Like you are repeating the event again. And you will waste your time, you will make him angry again, and try to apologize again. It's not advisable at all. So the recap and medical error is prohibited. Not only not advisable, prohibited. Don't do it. This is medical error. Yes, Dr. Tahani, I agree. GB surgery, Dr. Ihtisham. The GB surgeries are run privately and not linked to the hospital. So if you want to complain against about GP doctor, go to the GP surgery, yes, and complain. Pulse only address hospital-related complaint. There will not be an insert report here as the error wasn't made in the hospital. Yes, definitely, yes. The GP surgery, yes, he will be concerned to the GP mistakes. But what I mentioned earlier, you can send him to the Pulse, and the Pulse will tell him the process, how to complain to his GP. I didn't say the Pulse will investigate. No, the Pulse will guide him. Because you cannot tell him, I will guide you to the GP surgery. It's not your task eventually. It's a task of some authority or other authority who are responsible for this issue, right? I'm talking about the pulse of it. So the pulse of it, they will guide him to the GP surgery responsible for this GP. Psoriatic arthropathy is jargon. Yes, I mentioned. So it's complicated name or complicated term. Better to say the joint affection by your disease, which is psoriasis, for example, if you want to say. Or the best way is to say to your condition or to your disease. No need to mention unless you are explaining the condition. Counseling about disease, yes, you have to say the disease name. But here the patient already known as psoriatic arthropathy, psoriatic or psoriasis itself. So you can say your condition is controlled or not controlled. If he asks you what's my condition, means you have to explain the condition. But I don't think he needs to be explained the condition. Why? Because he is already known and he is already on medication. Yes, I think we discuss a lot of things today. It's nice topics in both scenarios.
Hi everyone. Can
Yes,
I just add one comment?
yes.
First of all, well done, Dr. Inas. Very well done. I would commend the same comment as Dr. Basim, but I will just add one point. When he asked you about if I stop methotrexate, that I will be having a joint pain. So I think you mentioned that if you continue having the methotrexate, you'll be having low platelets. But if you highlight the seriousness of the situation, inform that you could mention to him that I appreciate that you'll be having a joint pain if you stop the methotrexate, but the risk of having the methotrexate is more outweigh the benefit of having it. In such a way that you'll be having a low platelets, and this can cause you very serious bleeding. For example, bleeding in your brain or in your gut, and this very serious and critical situation will be. Yeah. So I think this could be appropriate answer for his question.
Yeah, thank you, Dr. Ahmed. You stressed this point.
you
I
very much.
didn't comment on it. Yes. Yeah, as I said, and Dr. Ahad said, and Dr. also Inas said, we will hold this medicine temporary and immediately call the concerned team. We will call the joint doctor to have or to give you another alternative, because he will concern about his disease. Of course, he doesn't understand that the joint problem outweigh the bleeding. So to reassure him, call the concerned team to have a look on him and to prescribe the best medicine in the best interest of his condition right now as alternative. Okay. Thank you, Dr. Ahad. Again, anyone want to comment? Feel free to comment. Like Dr. Ahad, mashallah, very good comment.
So I think, sorry, I just have a short
Yes.
comment. I think that she did very well, actually. And I think that we don't need to apologize a lot because the error wasn't
Yes.
done in the hospital. So just, I think even if she apologized for once and just say that, and
Mhm.
rather than going into more detail of that thing, I think just
Yes.
apologize and I think should go ahead and uh, complete the scenario. So I think that because it wasn't done in the hospital, so we don't need to apologize
Exactly.
again and again, because here the duty of the candor is basically for the GP as well, because when the complaint will be raised against the GP through Paul, as you were saying, so GP need to sit with the patient later on and explain and also apologize. So here I think in this scenario, from a treating doctor point of view, as you are being, so most likely I think that just saying apology, offering apology just once, I think that should be fine.
Yes. Thank you, Dr. Hisham. This is what we stressed on it. So at least once, no need to repeat or to re-apologize again and again. It's once only, just to calm the patient down. Thank you, Dr. Hisham. Anyone else want to comment? Okay, thank you, Dr. Ines, as well. Thank you, Dr. Muhammad and Dr. Ines. Thank you, everyone, for the attendance. I like to be more interactive like this session. Everyone has, feel free, please, to comment. It's not my session, it's all of you session and practice. Whenever anyone has comment or doubt, raise it, please, and you can comment by yourself. I'm not here to only judge. We are sharing opinions and trying to cover the most important points. It's a matter of puzzle game. So there is missing part or piece you have to put. Maybe I will miss it even during my comments. Anyone has a comment which can cover part or point I didn't mention, please comment on it. Thank you, everyone. It's time to end the session. When are you doing long clinical consultation? Okay, this week we will do 2 long clinical consultations, Saturday and Tuesday. So tomorrow we'll do short clinical station, and after tomorrow will be the day of long clinical consultation. See you there, all of you. Thank you. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
عليكم السلام، شكرا لك كثير.